All right, ready?
I'm ready.
All right, we'll go live here. Well, hello. I'm real excited today. I am very excited about this one personally because I'm trying to figure this out. Jeff Stinson, elder law attorney with Stinson Elder Law, however you want to describe that, um, is going to talk to us about the brand new Indiana Pathways program. Okay, so that is a unique situation, and so it was Medicaid Waiver, and now they changed the name to Pathways and changed the whole game plan. So and that went live what, July 1st?
July 1st. Yes.
So my guess is there's very few people even in the industry that really understand it at this point.
That's correct. And I will admit I am by far a super duper expert. I'm just we'll talk about what I have learned so far. And there's probably a good, I probably know about a thumbnail's worth. I'm sure there's a lot more out there, but I can certainly speak to the waiver portion of the pathways um, um, managed care system. We got to keep in mind that even though I'm probably going to focus more on the waiver side of it, Pathways itself is a huge system and it's a huge change within the Medicaid program. Basically, the way that Medicaid services folks over the age of 60 has changed significantly as of July 1st. So, not just folks who are needing nursing home care, but just folks that are needing help with regular everyday insurance has changed significantly under this Pathways program.
So why don't you introduce yourself? Tell us who you are, what your background is, and all that kind of good stuff, and then we'll kind of go into all of this.
Absolutely. So, as Jim mentioned, my name is Jeff Stinson. I am a certified elder law attorney, which means that um, certified by the National Elder Law Foundation, which means that I can say that I'm a specialist in elder law. Essentially, that means I have been tested, that I know what I'm talking about, and have been reviewed by my peers that they think I know what I'm talking about. So, that's one designation that's kind of unique to me. I've been in this field since the late 90s. So I've been around the block a few times. I've seen a lot of changes within the Medicaid program since the late 90s, everything from a more of a center social worker, you have a one caseworker approach to your when you're an applicant, to now more of a call center approach when we went privatization, and now this whole managed care, more of a HMO, we'll call it, type of process now. So I've seen a lot of changes over the years. I've had my own practice since 2013, so we've just celebrated last year our 10th anniversary, and we're just chugging along here. But essentially, what I do is I work with folks who are in need of some sort of long-term care, and that's where my expertise lies. Whether that's needing care in the home, whether that's needing care through an assisted living facility, whether that's care in a nursing home, could also be adult daycare. So different levels of care, and I help folks afford that care without being completely impoverished. Because what's important to know is there's lots of public benefits programs out there to help pay for this care. And why you'll hear that there are asset and income limits for these programs, you don't have to be completely destitute. You just have to work with an elder law attorney to find these legal ways to fit within those asset and income criteria.
Yeah, I would imagine most people don't get the benefits because they simply don't know how to do it. They don't know how to fill the forms out. In total clarity and transparency, we've worked with Jeff to deal with things in my own family. So, well, so we go to him because I'm not about to try to figure out how to fill those papers out. So, anyway, I appreciate you navigating that for us. Um, on this new pathways program, I understand that it's much broader than just the waiver portion of it, but and you and I were talking a little bit before we went on air, but is the pathway something that was already in the works, or was that something that they jumped onto after they had their big budget shortfall and didn't figure out how to pay for Medicaid?
Oh, it was already in the works before
Okay.
this budget crisis back in December. So it was nothing new. Um, I'll just give my opinion. I don't think that it was well thought out. I do think that they could have used some more time to use that. They needed a few more months to plan this out. They needed a few more months. Probably needed some time to use maybe some regions as pilot programs before they just jumped right into it. So I'm going to say yes or no. It was already in the works. They had intended to start this by July 1st. I think, though, that this budget issue may have exacerbated the fact that, okay, we're not going to spend any more time testing this out or so. We're just going to get this going as of July 1st. That's just conjecture. I don't know that for sure, but it was on the books to start July 1st.
Okay. Well, the reason I'm asking, I've been in the senior world, with us with Caring Transitions. I go to all these networking things and all these programs, and they would have speakers come in that were going to explain pathways, and they couldn't explain it to the people in the room that do it for, work in the senior world every day. And they couldn't answer the questions. So that didn't tell me that it didn't assure me that they had all their ducks in a row, figure out what they're going to do. So
Right. And if you've seen the media accounts in the last, 6 weeks or so, it looks like they still don't have their ducks in a row. There's been reports of providers not getting paid timely. Folks that are, and you'll see lots of things where folks aren't getting the services that they thought they were going to get. Lots of things like that. That I just, I don't know that it was thought through real clearly. That if with a little more time and a little more look and a little more practice, it would have maybe had a more seamless transition than this kind of a hiccup that we've got here right now.
would you want to kind of explain a little bit of what it is, and then we can kind of go into what's going on?
Yeah, yeah. Well, so I'll just kind of give the big picture of pathways here. So before this transition, our state Medicaid program essentially paid providers as a fee for service. So if I'm a home health care agency, I would turn in my bill to Medicaid. Medicaid would pay me on a service that I have delivered. Or if I'm a doctor that just saw a patient, I would turn in my bill and I would get paid for my service. Well, now with pathways, a Medicaid recipient and any provider has agreed to enter into this network. It operates it's a managed care entity. Think of it like your HMO under traditional insurance. So the state, rather than paying fee for service, is paying a set amount of funds to one of three managed care entities. Anthem, United Healthcare, and Humana are the three entities. And so the providers sign up with the entities. A set amount of the state just pays a set amount to each entity, and the entity is required then to meet the services and pay all the providers and divvy out the money. So rather than a fee for service, it's the entities taking this big chunk of money and deciding how to allocate the funds amongst the providers. So that's one big change that occurred here, and that's kind of the 10,000-foot view of what occurred here in July. Significant change. Now, you could maybe make an argument that, okay, well, if I'm a managed care entity, I probably want to deliver the least amount of services as I can so I can make the most amount of money. Now, we'll see if that happens. You could call me grizzled. I've been around long enough that I'm waiting for that shoe to drop. But there are some things that it'll take a while, I think, before we see something like that. But you never know. You never know.
I will tell you that in the industry, one of the things that I have learned from hanging out with all the people that do like long-term care or do like rehab, particularly and in-home health, they have done everything they can to keep people to stay off of one of those managed plan programs, and now all of a sudden you have no choice to be into one. So
Right, right. Because that's the other piece here is for the last decade or so, there's been this drive also for folks who have Medicare to drop their supplement policy, which I don't recommend, by the way, and enter into an Advantage plan. Now I know there's pros and cons, and I always talk to your health insurance agent before you make that decision. But the whole concept here is taking that model and applying it to Medicaid. And in fact, companies like United Healthcare is going to encourage folks to take their basically combine their Medicare Advantage with their pathways all together so that United Healthcare has all of that under one umbrella. Now you don't have to, and that's I want to clarify that, but that's one thing that these companies are wanting you to do is get it all under one umbrella. So again, that they can maximize their efficiencies and maximize their profits.
Interesting.
So that's kind of the big picture of the Pathways program. So one thing I've been warning my clients of, and I don't think it's as big as an issue as what I had suspected would be back in, say, March, is you want to make sure that your providers have enrolled with the managed care entity that you chose. So back in April, folks were sent letters that had already been enrolled in Medicaid that said you now need to choose one of the three managed care entities. Now, all three had to offer the same services, and then each one offered little extras. There were things, a little bit of dental, one, a gym membership, little extra things out there, and you got to choose which one. And I believe if you didn't choose, you were automatically signed up with Humana. Of those three, though, you want to make sure, if I'm in a nursing facility, for example, just because I'm on Medicaid as of July 1st, if that nursing facility doesn't take my managed care entity, or it's enrolled with my managed care entity, I still may not be covered because I have the wrong entity. Now, from what I've heard from most, as I've kind of asked most providers, I think they've signed up with all three. But for a while there was a couple of nursing facilities, for example, that said, I've signed up with two, but not three, or one, but not three. I think that's kind of went by the wayside, but that is an issue. And it's a nightmare for the billing offices for a lot of these providers, because rather than have one portal to send bills, now they have three potentially. And I know they're working on this background to make it a little easier, but it's kind of beyond my pay grade to understand all that, but I've heard it's still a hassle. So again, that's kind of the big picture of Pathways. We've taken how Medicaid provides medical services to folks that are aged, and essentially, rather than pay providers of those folks as a fee for service, we've now changed it to a managed care program. So under that umbrella, any type of long-term care benefit has also been absorbed under the managed care, the Pathways program, under the managed care program. So that would include nursing home care, and it also includes home and community-based alternatives to nursing home care. So a little history here, or a little explanation, I guess. Every state who participates in a Medicaid program that wants federal dollars has to offer nursing home care coverage as part of their state Medicaid program. That's a condition to getting those federal dollars. But they don't have to offer anything more than that. And we've been real fortunate in Indiana to have a state that's willing to pay for alternatives to those services. That's where a waiver comes in. A waiver essentially means a state goes to the federal government and says, we want to offer a little bit extra, but we want to cap the number of people that gets these extra services. We want to limit the amount of funding that goes into these services. So will you waive the requirement that everybody gets these services? And that's where the term waiver comes from. The feds say, yes, we'll waive the requirement that everybody gets some. So sometimes what happens with some of these waivered services is there's not enough funding available to pay for everybody that wants them. And I'll get to that here in a minute. But that's kind of where the term waiver comes from. And in Indiana, our waivers are designed really to cover home and community-based alternatives to long-term care. Uh, Whether that means I have to meet institutional level of care, nursing home level of care, or I have to meet intermediate care facility for persons with developmental disabilities. That's my two levels of care. That I have to meet that medical level in order to qualify. Prior to July 1st, for aged individuals, which is where most of my folks are. Now I work with folks who are disabled as well, but most of my seniors were in this space called the aged and disabled waiver. So that's where most folks were seeking these alternative services was through the aged and disabled waiver. When July 1st hit, Pathways absorbed the waivered services, but not only did it absorb the waivered services, it split the waiver, aged and disabled waiver, into two new waivers. One being the Pathways for Aging waiver. So if that isn't confusing enough, the program itself is called Pathways, but then we have the Pathways for Aging waiver. That waiver is for folks seeking those home and community-based services that are age 60 and above. And then they have the health and wellness waiver, who is for folks under the age of 60. So they split it there when they went to the Pathways program. So that's kind of the 10,000-foot view of these waivered services under Pathways.
What I was going to say, one of the things that I've been hearing, there's been more media attention on the younger people that are having problems getting their funds now. And which I think is a big problem, because in the industry that we are in, I'm seeing a lot of people really struggling in that area. So
Right. So one of the things that happened in this transition was that the new rules said that they were no longer going to cover um, parents of minor children and spouses. So they were no longer going to cover legally responsible individuals from being paid as attendant care services. So for a while, if I was a parent and I had a minor special needs child, the state could pay me to care for that child. And what better way to get good care than to pay the parent? Two good reasons for that was there's just a lack of caregivers for those folks. There's just not enough caregivers to go around. And like I said, second, who better to know the care regimen of that child than the parent? But when we went to this transition, they eliminated that funding for paying the parents and spouses, paying the legal responsible individuals, and instead wants to transition them to another service called structured family caregiving, as opposed to attendant care. Why? Well, attendant care pays much less, pays the provider much less. I'm sorry, the structured family caregiving pays the provider much less than they do under the attendant care. That's the main driver. So that's one thing that's getting a lot of media attention, of course. Unfortunately, the things that I feel should be getting more media attention that's not is the lack of funding, or actually there's enough funding now, but the lack of assigning slots to folks that have been waiting on these waivered services. So a little bit of history here. Back in January, the Division of Aging, which is the agency that was in charge of these, keeping track of the number of folks receiving services under the age and disabled waiver, announced that we may be running out of slots this fiscal year. Now, they didn't say how many slots they had left. They didn't say they would run out of slots soon. They just said, we might. That's all we got. We might run out of slots this fiscal year. And so, no one really took much note of that, particularly since it's been almost 11 years since the state did not have enough slots, did not have enough funding to meet the demand for these services. Yeah, there was a time where there was a wait list for the age disabled waiver. But even then, that wait period was not lengthy. It was months, not years. But now they announced in January, we're running out of slots. And then all of a sudden in April, they said, oh, yeah, we're out of slots and we're going to start a wait list. Now, they have, for that fiscal year, they had 50,947 folks that they had available in slots under that waiver. So they allegedly had used up all of those slots and they signed folks to a wait list. Now, the discouraging part was there was about 2,500 people that they had already promised services to. I argue they had already approved services to that they placed on the wait list anyway. Nonetheless, we have this wait list. Now, keep in mind that you can go to their website and you can see the number of folks that are being billed under the waiver. And if you look at, for example, May, I think around 42,000 people were billing the waiver in that month. So keep in mind, there's 50,000 slots, but only 42,000 were billing. And then the next month, only 41,000 were billing. So all 50 of those slots were not being used in the fiscal year. Why? Well, folks pass away and they don't fill the slots until the next fiscal year. So for that entire year, if someone passes away, that slot remains open for the rest of the year. If someone passes away or if they transition to a nursing home, that slot remains open for the rest of the year. Or they just go off of Medicaid, decide they don't want it, that slot remains open for the rest of the year. Now, the state says they're prohibited from filling those slots by federal law. I disagree, but that's the state's position. We can't fill those slots. So point one being, they started this wait list, looked like they could have filled the folks that were waiting anyway. For argument's sake, let's just say they were right and they couldn't fill those slots. Well, come July 1st, when we went to Pathways, they announced on July 1st that, and give me just a minute because I want to give you the right numbers here. Yeah. So they announced on July 1st that they had 10,574 slots available for the Pathways waiver. So that's folks that are 60 and older. They had a little over 10,000 slots available, and they had a little over 9,000 people on the wait list. Easy math, right? You got 9,000 people waiting. You got 10,000 slots. July 1st, great. Here you go. Everyone gets their services. Same thing with the health and wellness. Not as great as the number. They had 3,762 people waiting. They had 2,937 people of slots available. So they still didn't have enough slots to meet demand, but pretty darn close to it. The problem is the state decided we're only going to invite people off the wait list for Pathways at a rate of 800 people a month. We're only going to invite people off the health and wellness waiver wait list at a rate of 125 a month. So if you start doing that math, you'll find that it'll take close to 14 months or so to clear off the Pathways wait list, or excuse me, take about 10 months or so to clear off the Pathways, 14 or more to clear off the health and wellness. And that's not counting the people who are being added as we speak. So it's really, my opinion is really disgraceful how things are being handled at this point. So I'm going to get off on a tangent here. I know you and I were talking a little bit before we started. I encourage anyone that's hearing this, reach out to your legislator, because there's just not enough information getting out here about this. I don't want to place all the blame on Medicaid because, yes, some of this is driven by finances because there was an error in their budget back in December. They're trying to figure out how they're going to make up a nearly $1 billion shortfall in their budget. But at the same time, they're not getting any relief from the General Assembly as well. So this is really, although the General Assembly kind of placed this at the feet of Medicaid, they could help Medicaid out here with a little extra money coming in to the program, particularly on these home and community-based services. So I encourage you, write your legislator, call your legislator, say, this is unacceptable. We need to get more funding for these programs because for someone who's 85 years old seeking home care or seeking assisted living, waiting 14 months is just that's unconscionable to me. So
The death sentence to some,
it
so
is a death sentence to some.
yeah.
So sorry to get off on a tangent, but I just wanted to place
Well,
that
I
out.
appreciate it.
Yeah.
Well, there's also a few $1 billion of excess in the banks they could possibly tap into, so anyway.
There is. Right. So I know I'm not giving out a lot of encouragement here, but that is kind of the state of things.
Jeff, one of the things, I had a mentor who's a multi millionaire, just very very sharp guy, and one of his favorite sayings was, "I don't care what the facts are; I just need to know what the facts are." You can't fix something until you know what your circumstances are.
Yeah, yeah, yeah. And the circumstances are, I mean, I'll use a client of mine who was rendered homeless because of this situation. She was and again, I'm arguing she was approved for a waiver. She relied on that to give up the lease to her apartment because she really couldn't be living alone. She had a daughter who is disabled. She was struggling to take care of mom. Found an assisted living facility that would accept her and would accept Medicaid. It was a godsend to them. She'd given up her lease to move into this facility, and literally within days, she was placed on the wait list, rendering her essentially homeless. Now, she's very fortunate. She had a grandson who was recently discharged from the military. He was career military. He decided to buy a house, had an extra room so grandma and mom can live there while this is all figured out. But even then, that's not really a long-term solution because we're still got a disabled daughter trying to take care of her mom that she's struggling herself. So those are the stories out there that's the face of what we're seeing here with this.
Well, being someone who has dealt with family members and in so many situations, it's all of a sudden something happens, they fall off the perch, and all of a sudden health wise deteriorates to where staying at home is no longer a viable option. And if you've priced out, the places for care, you'll find out that very few people can afford it. Okay, I have heard Medicaid waiver referred to as middle class long term care insurance, which I think that's kind of where it falls into play. But if you take that rug and pull it out from under people, you're literally leaving them stranded.
Correct. I call it leaving them in limbo. That's been that's my closing argument on a lot of my recent hearings I've had on these issues. They've been left in limbo. They really have. And you're exactly right. We often call Medicaid long-term care insurance for the middle class simply because that's the way Congress has designed it since the late 80s. Yes, originally it started off as a health insurance program for the poor, but in the late 80s, Congress started expanding that program, adding services, changing the eligibility criteria So that's where we are now, to where it has become long-term care insurance for the middle class. Um, so that's kind of where we are right now. Now, I wanted to mention that, so Jeff, what about this wait list? What does all that entail? So let's start with how do I get on the wait list? Well, as of right now, folks still should be calling their area aging agency to get on the wait list. They are still the gatekeeper for these waivers, particularly the pathways for aging waiver. They will do a short phone evaluation that gets someone on the wait list. Now, the Medicaid agency has said then, for the most part, people on the wait list will then come off on a first come, first served basis with a couple caveats. One caveat is individuals that are transitioning from a nursing home or a hospital to home get priority. They get pushed up to the top of the list. And people who are getting services that are 100% covered by state dollars also get pushed up. And that's through a program called Choice. Not very many people get coverage through Choice, but it is a state funded program that helps with home care basically. And if you're receiving that, you get pushed up to the top of the list. That's where you prioritize. In the state just this week, maybe as late last week, has given numbers for July and August on who got priority and who got the first come, first serve slots for those first 2 months. Again, you start with a call to the area aging agency, and that will stay the same through July 1st, 2025. Then it's supposed to change to a private entity. Maximus is the private entity that it's supposed to transition to.
So so basically, I had heard that Socoa is no longer that gatekeeper, but they are for a year. Is that how that works?
As of right now, they are. So
Okay, I'd lost.
officially,
I guess
what was supposed to happen was when this transition occurred, the federal government said, Indiana, if you want to do this, the area aging agencies still have to be involved with 50% of the applications. Now, that trying to get through the different history here. So 50% of the applications. What did occur was the area aging agencies have been doing this historically, and when it went to managed care, they started negotiating with the managed care entities, and they weren't getting anywhere. So the state stepped in and said, "Well, how about the managed care agencies pay the AAA's this much?" And the AAA said, "Good grief, this is much, much less than what you've been paying us. We can't do this. We can't afford to do that." A lot of them said, "We're going to bow out." Now, I don't think they did. That's where I don't have a clear answer. There's some ambiguity. All I can say is right now the AAAs are still doing these assessments, although I do know there is one AAA up north that, and this is anecdotal, but I've had a colleague of mine that says if you call the AAA, they tell you to call the pathways, and the pathway tells you to call the AAA, and it's just maddening that circular reference there, and they're trying to figure out how to work that out. Otherwise, I know for sure here in the central Indiana region, you call Socoa, they will get you on the wait list. Also, if you're transitioning off the wait list, they are the ones that start you in the transition. Then they will do what they call a soft, what they call it, a soft handhold or something like that, where they hand you over to the managed care entity. This is where that 50% of the time, Socoa will still be the care manager. 50% of the time, the managed care entity will continue on as the care manager. And that will happen through 2025. What happens in 2025, we'll see. So that's the wait list. That's coming off of the wait list. Um, I did want to, yeah, and that they do have those numbers where they are keeping the statistics on this is where how many people they are assigning. August was pretty good. In the month of July, they gave a lot of priority slots away. The first come, first serve, there wasn't very many people that got first come, first serve. It mostly went to folks coming out of the hospital, out of the nursing home, on the choice program. August was a little better. There was only a handful that got priority slots. Most of them were first come, first serve. My disappointment was they are just now into December of 2023, at least according to my sources at Socoa. So if you have a plan that you were approved back in January, they haven't gotten to you yet. I would have thought, gosh, by now they would have started pulling people off of January, February, and they're just not there yet. So again, that's the frustration with this 800 of people a month issue. It just drives me batty how slow they're pulling folks off of there. And I mean, again, it's just doing a disservice to folks. There's so many providers out there. There's so many assisted living providers that have enrolled in this year to be service providers. We used to say, congratulations, you have a waiver and you have assisted living covered, but now you're not going to be able to find a provider because there aren't that many of them. Now there's a whole bunch of providers, and a lot of them are just like they got caught with their pants down because I can think of two in March that suddenly become providers, and now they don't have anybody to go into these beds. It's
Right.
it's just maddening. So that's kind of where we are on the waiver. Um, we'll mention alternatives though, because that's the question I get. Well, what do we do? Mom can't sit 14 months waiting on services. Well, there are a couple alternatives out there. Unfortunately, one is nursing home care. If you really are stuck, you may need nursing home care. That is fully funded by Medicaid. There's no wait list for nursing home care. Um, it is a challenge sometimes finding a facility with an open Medicaid bed, um, but that is one option. Another option is if you live in an area serviced by the PACE program,
Mm-hmm.
that's a really good option as well. So PACE is a program where essentially you enter into this agreement that says, I'm going to let PACE take care of all of my medical needs. And the concept is what they really want you to do is come to this service center. You can come there 5 days a week, but at that center, they take care of most of your medical needs. If you need to see the podiatrist, they come to the service center. The dentist is there. The eye doctor is there. Your physician is there. Everything comes. You need a shower, they can take care of that there.
And
You
they
need
pick
just
you up
need
and take
service.
you.
I'm sorry.
And they pick you up and take you.
That's right. And they pick you up and take you. They bring you there. So that's a really neat program. And then, of course, if you get to where you can't travel to the center, that's when they will provide a home health aide for you in the home. And if that's not feasible, then they do have contracts with assisted living through that program. And if that's not feasible, then there is nursing home care. Now, they're not going to they're not everyone's eligible. They want folks that are just starting needing that care. If you need assisted living, that's not the folks they're looking to service. They're looking for folks that can start traveling into that day center every day. But it is a good alternative, particularly if you're trying to stay away from a nursing facility.
And there's been that program's been on the south side of Indianapolis for quite a while, but it just come to the north side recently.
Right,
So
right. The north side it's been about a year and a half now, I
yeah,
think.
maybe I mean it's recent. Yeah.
Yep. And both have lots of energy behind them.
Mm-hmm.
Um, I've been real impressed. I've toured the one on the north side, and everything from the bus driver said, I love my job. And I'm not just telling you that. I really do love my job. And in fact, uh, I want to make sure I do everything I can to make everyone happy here because I love it so much. I want to make sure this works. So I want
The
people to
model
come
is
here.
pretty impressive when you hear about the whole package
Yeah,
of it.
It is. And of course, PACE has been around for decades. I remember back earlier in my career, back in the early 2000s, I toured a PACE program in San Francisco. So this has been around a long time. I think the one on the south side was the first in Indiana. It started around 2014. I think now there's probably 10 throughout the state or so. So it's not just Indianapolis. There's some up north, there's some down south. It doesn't serve the entire state, but there are quite a few of them. And that's a nice alternative to waiting 14 months to get waivered services. So
There's also, from what I understand, you can kind of help guide me on this. There's a tax credit housing sometimes, but the key comes into what their situation is, what, you know, but I've heard that there's at least one in town that will actually take someone while they're on the waiting list for the pathways because it's critical for them to have their beds full or they don't get their tax credit. So they're actually allowing people to come in. But the trick is finding which ones are in that mode at any given time.
yeah, yeah, and that that's the trick.
Yeah.
That's the issue there.
Mhm.
Yeah, yeah.
But it's something to try to dig under and see what's out there.
Yeah,
So
it's something else. And of course, I'd be amiss without mentioning the programs through the Department of Veterans Affairs. If you're a veteran or you're the surviving spouse of a veteran, there's potentially some services there, whether that's the cash benefit program through their pension, or whether that's some healthcare benefits through their healthcare program. Sometimes it's not a lot, but it is a way to get some extra funding to help pay for alternatives to nursing home care. So that's another place to go if you're struggling with trying to keep someone cared for outside of a nursing home. So,
so where do you see it going?
well, the the pessimist in me says I'm going to have a new practice area, which is advocating for folks who's getting their services cut by managed care entities. But I'm a lawyer. I'm a paid pessimist, right? So I'm planning for the worst and hoping for the best. I hope that never comes into fruition. But that's something I'm probably preparing myself for. I hate to see, that's why I got into this business. It's watching out for the little guy, right? I don't
Right.
if they've always received 30 hours a week in home care benefits, I don't want to see some managed care entity coming in and said, that's great, but we think you're only entitled to 10. That's unacceptable. So that's one concern I have. Um, long term, it makes no sense whatsoever to push people into nursing homes.
Right.
We
It's so much more expensive than the. I always said the reason Indiana was one of the better Medicaid waiver states is because supposedly we're fiscally conservative, and instead of paying $10,000 a month, you pay $5,000 a month. That's a massive, and I'm rounding numbers. It could be significantly different, but otherwise, you're going to pay at least twice as much when they have to bypass and go to the skilled living.
And that's exactly right. Study after study after study has shown that taking care of someone in the community is much, much cheaper than taking care of someone in an institution. And frankly, the state has done a great job of transitioning folks from nursing facilities to home and community-based services. I mean, I can remember starting out when someone would come to me and say, Jeff, we need help paying for stuff. And I would say, well, sorry, but you got to put your mom in a nursing home. That's the only way you're going to get funding. And it was a real blessing for me to tell folks, hey, we can get you help in the home, or you don't have to go to a nursing home. There's assisted living facilities out there that you can go to get some help. It was great. I really felt like that's one thing that Indiana was on the forefront of. We were doing a really great job. I could go to national conferences and brag about my state for once to say, hey, Florida, you guys don't pay for a home. That's a bad example. You guys don't pay for assisted living. My state does. And now it seems like we're trying to turn the ship that has been heading in the direction of home and community-based services for at least 10 years, maybe more. And we're trying to get this huge ship and turn it back in the other direction towards institutionalization. It just makes absolutely no sense. So you asked what the future is. I'm just hoping common sense hits the legislature here and they put some pressure on Medicaid and get the funding righted and get the ship back in the right direction, get the funding back in place where it needs to be so that folks that are needing these services have them available so that we're not in this position of waiting months or years to get services that folks need. Because, face it, 14 months, it's delay, deny, and hope you die. I mean, that's really where we're at right now.
Well, the bottom line is it's gonna cost the state significantly more money and trying to save money. Okay, they're being penny wise and dollar foolish. But
Sure.
it's additionally people are gonna die. I mean, you've got to. I mean, unless no BS on the side. It's if they need that level of care and they can't get it, and families are across the country or whatever it is, which, I'm dealing with caring transitions. I'm dealing with families all the time that I'm having to deal with a senior who's really on their own.
Correct. Yep. Yep. Yeah. And we see that a lot. Not everyone has a family like my client I mentioned. Not everyone has a daughter that can pick up and take care of things while they're waiting to come off a wait list. Um, one of my other clients that are in this same situation, her closest living relative lives 7 hours away. And actually, she just sent me an email this morning saying we're not going to make it. She has to move somewhere now. She's not going to be able to stay in her home anymore. The neighbor checking on her a couple times a day, or us private paying for a few hours of home care. It's not cutting it. She needs much more than what she's got needs, and I don't think we can wait for the wait list at this point. So unfortunately, you're right. Either her health is going to be in jeopardy, or she's going to have to go to a nursing home. That's her choice, and it's unfortunate.
So what do people need to do?
Well, so from a practical standpoint, if you have any inkling of I need or my loved one is going to need these services, get on the wait list now. The earlier, the better. Even if you think it'll probably be a year before my person needs these, get on the wait list now because chances are that's pretty close to when you're going to get pulled off the wait list. So the earlier you get on the wait list, the better. And then, I'm please, please, please. I mean, I know that it's a pain to write letters and make calls and so on. I know the average person doesn't want to get into all that, but we our legislators need to hear our voices out there. Just there's just not enough attention paid to this right now. And the more folks that step up and say, you know, we need these services, and even if you right now you think, well, what's it mean to me? Um, you're going to have a loved one at some point in time that is going to need these services.
Or you're
So,
going to be that loved one.
or you're going to be that loved one. So reach out to folks, tell them this is important to you. You need we want our legislators to look into this. We want to figure out, it'd be nice to figure out how this budget error started to begin with, but more so, let's fix it. Let's get things in place so we're not leaving people hanging for months and months or years getting services that they absolutely need, or face it, they're going to jeopardize their health without
I would say that speaking from experience myself, and get a hold of Jeff or somebody like Jeff. Okay, somebody that does that's what you have no idea how hard it is. That's like VA aid and attendance. I don't know what the percentages are, but I guess that most veterans don't ever get a penny of their benefits because they don't know how to do it. It's so complicated. And, when we first met, I had dealt with it, tried a DIY it myself with my father in law. and 18 months of getting rejections when we needed that money desperately for he and my mother-in-law. He was actually passed before we ever got the money. And I finally got mad, okay, because we still needed it. We were just getting these rejection letters. I ended up calling a friend of my son's who was a congressman and said, "Is there anything you can do?" And 24 hours later, we had it. And I'm going, "You shouldn't have to know a congressman
Right.
to get this thing done." And then, of course, when we did with you with my uncle, it was like 11 days, if I recall. And I'm like, "Oh my God, this is the greatest thing since sliced bread." And I know you probably can't guarantee days, but it was like 18 months was a big difference, So
Yeah.
so
Yeah.
it's critical to
Yeah.
get somebody who knows how to fill that, get the I's dotted and T's crossed, and
Yeah, I appreciate that. Yeah, we certainly do our best. One of the things I have with VA is I have a card that allows me to get into the VA's computer system to see how my clients' applications are being processed, so I can try to curb any issues before they get too far along in the process. Um, you know, certainly can't guarantee days, and they're back to they were doing pretty good. They're now back to months before we get decisions, but um, still we try to avoid years.
yeah.
That's the good news there. We're not getting years decisions,
Well, the only
but
reason I got it done quick is because I literally because I had a congressman's,
right,
and had I not done that, I don't know if we'd still have it.
yeah, yeah. Well, and to your point, there is, you know, I would I would find something else to do if we could make this easier for folks for VA, Medicaid to where they don't need an attorney. Right now, I wouldn't send anybody, and I know it sounds self-serving for me to say this, but I wouldn't send anybody to a Medicaid office, Social Security office, or a VA office without representation, or at least talking to representation before submitting an application. That's tragic. But I I challenge the government, put me out of business. That'd be great. I'll find something else to do. Now, fortunately, I think I'm good through retirement, or at least good till I get my kids through college. I don't have any worries there, but I'm fine. I would be glad to find something else to do if we could do this better. I just don't, unfortunately, I just don't see it.
Well, Jeff, thanks so much for coming in and explaining this. I know that it's frustrating. I know that I don't know how much you can talk about this, but I know you're carrying the torch for the industry trying to fight a little of this right now. And I appreciate that because that means you're putting a lot on your shoulders to try to deal with that as well. But anyway, thank you so much for being here. Hey, wait a minute. I see I have a question here. Let me see. Good information. I believe a ship is doing as much as we can to help in this program. And Bruce, yeah. So Bruce Mueller, if you ever need anybody to talk to about ship, Bruce is a good guy for that as well. So yeah,
And I can reiterate that Bruce is a great resource.
so well, guys, thank you so much. Everybody, thank you for coming. If I don't have any more, well, here's another one here. Hang on a second here. Oh, yeah, I got it. So I got that one covered. Anyway, Jeff, thanks. I really appreciate it. I know
Anytime.
myself. I've been trying to figure this out for a while and couldn't figure it out. So it's maddening to try to figure that out. So so thank you for coming and sharing.
Anytime. My pleasure.
All righty, guys, take care. Bye bye.
Bye bye.